Obviously, there's the healthcare crisis, but you also have, Navajo Nation is not like many cities where you could order from Instacart or, Uber Eats or something like that and get food to you. There's not as many supermarkets, and there's internet connections, connectivity issues that would interfere with Zoom learning. My nephew is doing his classes through Zoom. So what are the obstacles that are being faced now as far as food, education, and just the normal necessities of life that people would need if they're stuck at home?
So I'm going to kind of take it from just like you said, from the public health orders. The president and the Emergency Management Commission and the Health Command Operations Center have issued a series of public health orders over the past 2 months to mitigate exposure, prevent spread. And that includes a stay-home order that we're currently under right now. You really are only supposed to go out during the week, so Monday through Friday from 5 a.m. Monday to 8 p.m. on Friday for essential goods and services. You're not supposed to be congregating in public or meeting up with your families. Even though we live in a very rural area, we're an incredibly social people. We define so much of our life based off of our relations with one another or with the natural world. And reaffirming those connections, either through spiritual activities or spiritual activities with our family members or our friends or our clan relatives, are incredibly vital to our, some people might say religion, our culture, our tradition, and finding meaning and value in our communities. When that is cut off for the sake of health, when in general, the logic is that these things build toward health, build toward community, build toward the good in life, I think it adds a psychological dimension that is unique, say, from city life, where a lot of people live in an apartment. They interact with the folks at their work. They have a small social net of friends and or workers or a family, whatever, and they're able to continue that. But if you live, say, in Round Rock, Arizona, where I am right now, you have a few different grocery store options. The closest one, though, unfortunately, is not the greatest. There is a grocery store about a half an hour away in Chinle, Arizona. And I'm lucky because I live right off the road. If you live farther off the road, like most people do, I'm talking about the paved highway, then you could have a 30-minute or hour-long drive before you even get to a paved road.
Wow.
Now, to go get groceries from there, that is a hotspot on the Navajo Nation. So you're going in to potentially expose yourself. At that grocery store, they're scanning people with the little temperature guns, and they're turning people away who have fevers. So that by itself is a little bit of a traumatizing experience. But it's a very small grocery store. It's very limited. And that company spoke to our president, I think, in March, the CEO, and said that they were all out of bottled water and they might not get any until the summer. He buys all this bottled water in the winter and he uses it and just saves it and redistributes it over the summer period. So when that small limited grocery store is out of essential supplies, then you have to travel to the border towns. And that's Farmington and Cortez, I'd say primarily for where I live, or Gallup, New Mexico. So Cortez in southwestern Colorado, Farmington's in northwestern New Mexico. Those are both 2 hours away. So that's 2 hours to go get groceries, maybe try to find some water, look around for some sanitation, look around for gloves or masks, and then get home before it's curfew, because otherwise you're going to be paying a $300 ticket at least for breaking curfew. If you work during the week or you have to take care of your kids, it's incredibly difficult for you to obtain essential supplies and food and comply with the curfews. the weekend is not an option anymore for people to do that. They can't go out because of the lockdown that's now been put in place. So it's incredibly cumbersome to carry out some of the, let's say, the food and the essential worker, the essential supply runs that you need to do with the current public health order restrictions. They are important, but I think there's probably a better way to fashion it with, keeping a certain number of people out of stores, et cetera. Mm-hmm. I want to mention that there's one town, a border town called Gallup, New Mexico, that actually just received permission requested from the governor of the state of New Mexico, Michelle Lujan Grisham, to have a shutdown this weekend. Now, Navajos go to Gallup quite often, and there's a very tortured history there. And I think people who are familiar with border towns in Indian country know this story. It's not something that's unique to the Navajo Nation, but basically these towns profit off of Navajo commerce due to the lack of stores that are on the nation. And the way that this whole shutdown rolled out for Gallup was incredibly concerning. If you're a Gallup resident, there's a lot of Navajos live in Gallup, and that needs to be said. I think it's a town of about 25,000, maybe a little bit less, and a little under half, I think, are Navajo. But it's surrounded by the Navajo Nation. It was built off the Navajo Nation's money and the Navajo people's money. And the message that seemed to be sent was, keep those infected Navajos out of our town. They're going to compromise us. They're going to hurt us. And they are less than and unworthy of being here. And I'm incredibly hurt by the way it was rolled out. I used to live in Gallup, New Mexico when I worked for the Navajo Division of Transportation as the airport's manager. Commuted there every week and onto the nation and to work. And having been a former resident, I know how much Navajo people have enriched non-Navajos in that town. And it was the outgoing mayor, the new mayor, who petitioned for this. So they're using the Riot Control Act to perform this lockdown, and they're blocking off and barricading the roads with coordination of state police and local police. We're increasing and militarizing interactions between police and our people at a time when we need to be expanding our compassion and empathy and over-explaining the importance of these public health orders. So that's a new development, and it shows you that no matter what town you go to, you're only as good as your dollar. And if your dollar's too infected in their mind, too dirty, then they don't want you. And they'll wait until it's on their terms to have you back in. So, I'm hurt right now. I'm very disappointed in the state and the city for the way they rolled it out. They didn't announce it until very late on Friday. So people, like I said, in my area, they travel 2 hours to get down to Gallup to go get their feed, to go get all sorts of things for essential supplies, farming, ranching. Maybe they need some new paneling or they want to buy some hay. They head down there. Say they got there and it was right at whenever the curfew was, they had to turn around or they had to go to Grants or Farmington or Cortez. They're still going out in public. They're still going to go do that.
Right.
But now they're spending way more money on gas. So I just wanted to bring that up. Sorry, Jordan, at the end, because it's something that I think is going to occur in other towns, and the way that it was done, the law that's used in New Mexico is so concerning. We have a huge issue with our unsheltered relatives who live in Gallup, or I shouldn't say, sorry, they live or they pass through. A lot of them have dependency issues, and they have family that they travel between on the reservation and then spending time in Gallup. So there's a huge outbreak at NCI, which is kind of like a sobering center in Gallup. And they had, I think, 70 confirmed cases out of 150 or 170 that had been tested or something as of a couple of weeks ago. And I don't know exactly where that is now. When you say the Riot Control Act, it gives you the ability to clear the streets, right? The big thing is about order control of public areas. So there is a history of police brutality in that town. There is a history of people being taken advantage of in that town in an inebriated state. And my fear is that this will empower our neighbor in this town with the aid of the state police to do some truly awful things to our unsheltered relatives or other Navajos, feeling that they are empowered by the governor to perform this duty, and they need to do whatever. But that's what hurts me, because you take a vulnerable population on our streets, a targeted population on our neighbors' streets, and you give the tools of the state to harass them and potentially hurt them really badly with no plan for how you're going to take care of them. When that outbreak took place, they had to get rooms at Motel 6 and these other motel facilities in order to segregate them. And the response was super delayed. So that's just another issue with our people in our nation, where we have large populations outside of our land base, or even though that is traditional Navajo Diné territory, but there are other sovereigns who can act upon them. And to me, what's most tragic is that this was done with the full, I would say it was the coordination and confirmation and approval of the Navajo Nation President's Office. So when the information was provided to the legislative branch, we immediately put out a press release and called the governor to bring up some of the issues that I just spoke about. But it wasn't rolled out right.
Right. And my last question is, how could people help? I mean, it sounds like you could use volunteer nurses, obviously food, I would say maybe even mental health practitioners. How could people help? The tribe, which really is, like you said, as big as full American states, with far less resources than those states.
So there's a few different ways to contribute to the cause. I think that something that's been incredibly inspiring during this time is how local community leaders and, say, Navajo Nation community leaders, so non-government officials, maybe they're former government officials or they're not acting in their official capacity, have stepped up to provide mutual aid. And they've been coordinating all sorts of different things, whether it's seamstresses sewing masks and distributing them, whether it's, for example, the former Attorney General of the Navajo Nation started a relief effort and has been able to raise a tremendous amount of money. And then there's just the local folks who are going to buy potatoes and flour and oil in bulk, and they're distributing it to elders. The way that people can help is manifold. If you have N95 masks, PPE, gowns, my local hospital here, we're out of gowns. So they're using hazmat suits. I don't know how long that's going to last and when they're just going to go to trash bags. So that Chinle Hospital facility that I was telling you about, that's a half an hour away where most of my constituents are served, that's the level of healthcare and resources that they're at right now. So if you can send gowns to Chinle Hospital, I implore you to do so. I'm happy to email you just the contact information for contributions if you want to put that in like your notes or something. I don't know how you can distribute that. So there's that. And then we've started, my family is kind of funny. We're unique. I'm Navajo on my mom's side of the family, and I'm Jewish on my dad's side of the family. And I grew up between the res and Maryland, right outside Washington, D.C. So working with a nonprofit at our synagogue, or just the synagogue's nonprofit, we've created a fund for people to contribute directly to my chapters. So those are a lot of folks who who know me or have a personal connection to this area and this community, and I can send you the link for donating to that. That is primarily to provide supplementary resources to existing operations. So I was telling you about how like our community health representatives or like these public health nurses, maybe the chapter people, grazing officials, folks like that whose jobs are essential and they have to continue doing their work. They need PPEs. And so we've been providing them with PPEs. And then when it comes to preventing the spread and protecting our traditional knowledge healers or elders, we need adult diapers. We need things for elder care. Households, these multi-generational households, we're working on provisioning them with food, with support from that Attorney General who had done the fundraising. And that's provisioning food for 2 weeks for a household and customizing those boxes for each household. So say you're a single 0 income household and you have 3 kids, you need diapers, you need baby formula, all of these things. So food, essential supplies for elders and young children, those are needed. PPEs, gowns for the hospitals. And if you don't have those things directly, financial support is great because it allows flexibility for local community organizers or institutions to purchase those items for our frontline workers and our elders.
Great. I definitely want to keep in touch with you because unfortunately, as I'm sure you're used to, the national media doesn't cover the outrage of, communities and indigenous people. I was at Standing Rock off and on for 6 months, and I've covered other indigenous communities. So I think it's very important to keep the spotlight on the unique struggles and vulnerability that our indigenous population has in the face of this deadly pandemic. So thank you, Carl Slater, a Navajo Nation Council Delegate. And yeah, we'll definitely get those links up under the video.
Cool. Thanks, Jordan.
Okay, great. Have a great day.
Hope you enjoyed that last video. Hop on over to statuscoup.com where you can sign up for our email list and become a member for as low as $5 to $10 a month. Membership is how we grow. That's statuscoup.com/join. And remember, join our email list so we can grow the revolution with you.